Aboriginal and Torres Strait Islander health workers are critical if we are to close the health gap. They are highly trained and highly skilled. And like other health professionals, they have a clear set of professional standards. Katherine is home to the Wurli Wurlinjang Health Service, an Aboriginal community-controlled health organisation catering to Aboriginal residents of the Katherine area, as well as remote communities. All Aboriginal health workers employed at Wurli are registered practitioners under the national scheme. Bachelor Institute provides the accredited course for Aboriginal and Torres Strait Islander health workers, and at Wurli, trainees have the benefit of training on the job with a trainer employed by the health service.
Aboriginal and Torres Strait Islander health workers are in a unique profession, and I actually put Aboriginal health workers above what we offer because they're the backbone of Aboriginal health.
Dr. Latisha. Hello.
They bring their cultural knowledge, which is invaluable. So even though I'm an Indigenous doctor, I'm not really from this country. So the knowledge that they bring to me about this community, and it's a very diverse community in Katherine, is invaluable.
I know her father.
Okay.
And he had a heart complaint.
Oh, did he?
So the blood pressure.
I work with the Aboriginal health workers in a multidisciplinary team. With Wurli Wurlinjang, the clinical service is delivered by Aboriginal health and Torres Strait Islander health workers first. So the Aboriginal health worker will see the client, make an assessment and enter the notes. And the assessment's a comprehensive assessment within a holistic framework, so looking at all elements of the person's well-being and ill health, and then provide me with the history and both orally and in written information. So I'm really led as the doctor by what the health workers inform me about. So it might look a little bit scary, but Sandy and I work together. And it's important to have that teamwork because when people get sick, not one person can save someone, it's a team effort. And if there's people around, then we have to utilise everyone's skills and their leadership. Sandy, we know that Angie's got chest pain.
Yes.
So when we take Angie into the treatment room, what do you think we should do?
Okay, according to CAPA, I'd like to give her 300 milligram of aspirin.
With the discussion with Sandy today, we work together to make sure that we're up to date with the evidence-based medicine, and that's what our CAPA manual's based on, and that's the clinical tool that's used in the Territory for all rural and remote services. Even though we know that she's got diabetes, personally as an Aboriginal and Torres Strait Islander doctor, I feel it's incredibly important to offer that upskilling and ongoing learning, and it's a dual process. It's not just a one-way street, it's a reciprocal relationship that I have with the health workers.
The trainee Aboriginal health practitioner model that we have here at Wurli is quite unique in that we actually employ our trainees. We're looking at blood pressure today, so what's blood pressure?
Pressure of the blood in the heart and arteries.
You know what, like a normal blood pressure range? Here we're training adults, so we're looking at adult learning. That's our normal blood pressure range. Adults bring to the training, to the course, their past experiences, past skills, transferable skills from other jobs and certificates that they've done. 90? 90? Yep, okay. So that's
tree lopping. Before that, just truck driving. The reason why I took up health work is I was sick of going to all my mates' funerals, Indigenous mates. In the last 3 years, I've been to about 20 funerals, mates that are younger than me. Because I think the nerves were all gone. Working outside of health, you get all the negative feedback about the countrymen. And I thought, well, get in there and fix the problem, which is their health.
what might have happened in an acute situation.
The blood pressure can go low if they're bleeding.
Our model here at Wurli is that we have a training centre where we do theoretical and practical training, and then we go into the clinic. Keep your finger on there. And in the Territory, we've been very lucky to have had registration under legislation for quite a few years, and then all our trainees have trained to that level and been assessed and graduated and had their certificate. A renewable registration every year, and they have to meet certain standards to be able to renew that registration every year. The scenario is someone's just seen two cars crash. There's no extra help from doctors. And you are it. Okay. Hold it. So they're getting a broad range of experience and a broad scope of practice, because that's what they have to be able to do at the end. And I also say to them, you're being trained to work anywhere across Australia, especially now with national registration, and you may even want to take your skills overseas. So it opens up a broad scope.
I should ask her if her grandmother or auntie could come and consult so they can help her at home, you know.
That's good.
Yeah.
You see examples like Letisha Jackson come in here as an 18-year-old. You see them grow, you know, right from day one, and then you see them stepping out there.
We should give her penicillin.
So the health workers can give penicillin injections, can't they?
Yeah.
We can do that.
Should we do daily dressings here then, if families... I've been a health worker for about 5 years. You just get more knowledge every day, and you meet new people that you didn't, you know, you lived in Katherine. And I feel like I'm giving back to my community, you know, my family, my people, and looking after them. That's what I enjoy about it. Thank you. But I'm happy and I'm grateful I'm in a job that I want to be in, you know, and that's what it is for me, you know, just learning the different things and working with great people and the good teamwork and the communication. And we all look out for each other and teach each other, especially like with the doctors teaching us things like suturing and me teaching the trainees with dressings and stuff like that. Like, I love that. I love teaching and I love learning. You've seen that she is diabetic?
Yeah.
So now what does it prompt you to think about? What other observations should we be doing?
Going by a chart there, it looks like, 2 and a bit months ago. So she's up for another checkup and HB.
Albert, he's in his 2nd year of his training. Normally we look at the patient's file first. I go through with the trainees and ask them, you know, like, what observations do you think we should be doing in this consult before they come in? So then when they are in the consult room, then Albert already knows what to do.
This way, take a seat.
This is Albert, he's one of our trainees. Is that okay if he sits in this morning?
Yeah, that's fine.
Albert, can you start doing normal obs? Yeah. So we'll get her temperature, blood pressure.
I think we're better than the hospital, to be honest. I'll place this under their tongue. We screen them better than the hospitals and then put them out for the doctors to come in and see them then. The doctor's got a baseline for them then. Can I get you to come and sit up here, please? Yeah. I'll just check your ears out. I've achieved something more. You feel better inside yourself knowing that you've helped someone that lives out in the long grass. You've gave them, well, you've put a smile on their face, literally. You know, they've got nothing compared to normal Australian people. It's like jumping on a train and the train hasn't stopped. It's going full speed ahead. As I go on into my journey, it's picking up more speed, you know, and stopping at more stations, picking up more people and cruising. That's how I feel. Another train.
Then we've got the other side of it, which is the cultural brokerage, and that's a really important part as well, being able to meet the person and take time to sit with that person and get the full story and come up with a plan of care.
You said there was a stick there and it's just right there for reading.
Can you see him?
Yeah.
We'll have clients that live in the long grass. They haven't got access to showers. We will give them a shower at the back. We'll cook them breakfast, and we will do whatever it takes to make them feel like they are special.
And knowing that the person who's looking after them is able to be trusted, you build up a rapport with that person, there's two-way respect, and there's that cultural understanding. So that's a really important thing. A lot of people don't realise how important that is. And for any culture to be able to be cared for by someone, you know, who understands and knows about and works within your cultural activities, life, whatever it is, that's very, very important.
Did you put that stick in there because it was itchy?
Yeah.
You just advise him, you don't put nothing in there, and if he uses the earbuds, it's compacting the wax. So we can relate to them because we are Indigenous, and we will make sure that they do savvy what the doctors tell them, because they'll sit there and they'll say, yeah, but they don't really savvy what they're saying.
What I mean like that?
Yeah.
Sandy is the trainee health worker. They have to be supervised until they get registered to give them that little bit of experience and just to show her what we normally do. How to screen the client, introducing her and letting them know that she's a trainee and to get their permission and to get her to build that trust up and just to do what we do with them normally. Notice? Yeah. That's how you tell this young fella is a renal client. This is my 5th year that I've been registered. I was a cleaner, had nothing behind me, and I needed a trade to be able to support my children. It's a career. You always got the chance to move up, whereas a cleaner, I couldn't move anywhere. So once you finish writing your story, then we just start doing the OBS according to what's on his medication chart.
When did you go renal clinic?
Learning on the job is a good thing. You are doing the practical side of your learning, whereas you do your theory work in bachelor.
Let your patients see you washing your hands. So if they don't see that, they think, I come in and touching me with dirty hands.
They have got a model clinic there, but it's not the same as actually dealing with real clients. Just ask him if he's checked his sugar level today. It's out of a textbook, but it's reality when you sort of get in there and you work with the clients, and it's what you're exposed to and learning who the people are.
So you got one of these at home?
Yeah.
This one? Yeah.
But you can achieve anything that you set your mind to, and there is positive support up here, and that's why I have gone as far as what I have. And I hope to make a big difference in these mobs' lives.
Let me know if it hurts, okay?
We're just going to pull him out now, Gordon. Hey, too long.
Once they've graduated from this training program and they've gone into the clinic as autonomous clinical practitioners, then they're really seen as the leaders because they're looking after our people.
I'm going to take some blood off you and I'm going to give you it. I just think it's a wonderful profession for young people and for mature age people if they're interested in health, because there's the science knowledge as well. So it's not just about helping our people, but it's intellectually challenging as well.
There is something that we have missed, but I'm testing you to see if you know. My vision, I want to become a leader, you know, like Wurli, they help me to go to these leadership programs and stuff now that I do. And I want to do that because I was really, really quiet when I first started. I didn't hardly talk to no one, you know, and I just stuck to myself. But now you see who I am. You know, I got a big mouth. People try and shut me up now. So we'll just do a random sugar today. To make sure I see myself as a role model now for my family and my friends and the young people back in my community, you know. Because I don't want them drinking grog all the time and under the bridge, you know, down by the river. Because that makes me sad, that makes me, you know, and I want to help them, and that's why I'm here. And I want them to see that if I can do it, you know, they can do it too.
Aboriginal and Torres Strait Islander people who are health workers do have a leadership role in the community, and it's not just a 8 till 5 clinic hour leadership role, it's 24/7. And yeah, certainly people look up to them in the community.